Hi everybody, welcome to tonight's presentation. I'm working in the systemic space, so I'm wanting to just share with you the kinds of things that are happening because of COVID and how the types of announcement that the government's making, the changes that are coming, and then Karen will give you a bit more detail on the ins and outs of it. But also really just wanted to I guess let you know that the kinds of avenues that we have to report what's going on with you guys on the ground and how we can feed that beyond the four walls of family advocacy to various, portals. It's probably not a good word to use, is it? with NDIS, but just really just so that you know, it's really good to let us know when things are going wrong so we can feed it up the line. So the first thing that we've been told is with the 1-800 number within the NDIA to press number 5 if you have anything remotely COVID related. And so it doesn't have to be a health related issue. It could be to do with education and education related issues. Say if you need a teacher or the teacher's aide might need PPE, or you're not sure where to get the supply of that from for a support worker in the house, and things like that. So if there's the people that are under the 5, apparently we're told that if you press 5, the people answering are up to date, trained on how to resolve your issue, or will do the best they can to try to resolve your issue quickly. The other area that we have where we can contact is the advocacy organisation escalation team. So if there's an issue where you've followed the normal procedures and you've come to a dead end, or you just can't get any further and you need a little bit of extra help, that's when you can let us know and we can speak to them about that and try and resolve it for you. And if it, usually it's fairly complicated matters, but sometimes it's a really simple thing that we can by speaking with the escalation team, we can help resolve it. So just keep that in mind. The other thing is the participant service guarantee was promised the first to come through on the 1st of July. Now, since COVID, we're hearing that there is some delay in that process. We haven't heard anything official yet. There haven't been any specific announcements about that in the media or from the government directly yet, but that's what we're hearing. What they're saying is that we're definitely still focusing on children and participants that are needing specialist disability accommodation and assistive technology. So we'll keep you posted as soon as we hear any more on that. If there are any NDIS related school matters, since COVID has come about and kids are starting to get back to school, we have a contact within the Department of Education. They've got a COVID-19 task force, so we can try and help resolve any issues you might have in that space. So you can just move on to the next slide, Clara. Each week, the other space that we're working on is the disability community of practice, and so the Department of Health has set up about 30 of them, and we're involved on a weekly basis with the disability community of practice, and it's helped us get some real-time responses for issues that families have come up with. So if you, for example, personal protective equipment, Karen will talk a bit more about that later, or any kind of sort of health-related matter, whether it's if your child ends up in hospital, how do you ensure that you can stay there as the parent, and what kinds of policy or documentations can we point to make sure that is in place within the hospital that you might end up in. And there's also cross-pollination between the departments there, so that the Department of Health will speak with the Department of Education as well, and the Department of Community and Justice. So trying to sort of resolve things a little bit quicker than normal, cut through a bit of red tape. There's also a COVID-19 children and young people with disability group that's national group that we're getting together every week and talking about the latest issues, what's coming up, and whether that's education or NDIS or health. But so if there's any, they're feeding into us and we're feeding into them, but we're also feeding it up the line to the peak bodies, because the peak CIDA who are running it are also on sort of the national peak bodies that are feeding directly into the federal government and the federal Department of Health. The other thing I thought I'd mention was just that there's a recent federal case which was looking at the reasonable and necessary test. You may have heard about it in the news that there was a woman was granted the funding for sexual work or sexual therapy. She contested the matter. It went to the Administrative Appeals Tribunal, and they said, the AAT said that she could have the funding. Then the NDIA appealed that, and the federal court said that she could have the funding. And so it's actually, Karen's going to talk a little bit more about the reasonable and necessary test, just to kind of give you a little bit more detail on the types of things to think about if you're not quite sure whether you can fund something or not. And then there's the Joint Standing Committee. The NDIS Joint Standing Committee have just put out their recommendations on supported independent living. We put in a submission for that. We had probably like 100 of our families putting in for that, and we're really pleased that some of our recommendations were acknowledged and put forward. For example, the advocacy funding and the need for advocacy was acknowledged, and that's been a really important battle with the Stand By Me campaign that's been going on for a few years now. And the other sort of space that they acknowledged was where somebody is in a congregated setting and they want to live independently, to ensure that measures are put in place so that can happen, and that the right supported decision making is actually happening. So we're waiting now for the government's response to that, and that can take a few months. So, but when we get a response from that, we'll certainly keep you posted and let you know. And so the next slide, Clara, is just every quarter there's an NDIS report, and they have put out that they will be, they want to be better at engaging with participants. They want to be more transparent, so they want to make sure you've got access to information, and that your plans are accurate, consistent, up to date, easy to understand, and it all sounds lovely. But even I know, like, even for example, today I got a phone call from somebody who said that they asked for a draft plan, and the NDIA said that they don't. The planner said that they don't have the facility to do that. But even though the minister announced in November that draft plans would be in place by April 2020. So it's just important to know that these kinds of things are officially there, so that you can push back when it comes to your plan review to ask for a draft plan, so that you can actually make sure that everything in there is correct before it becomes an official plan. The other thing is being more responsive. So they want to make sure that you're supported, that your independence is maximised by addressing your individual needs and circumstances. And so there were a couple of measures that were happening. One in New South Wales, where they were getting the participant and planner and the partner to have joint plans together, and they were requiring face-to-face contact initially for that. And so since COVID, that's had to be stopped. So that's just had to be shelved for the moment. There was some joint planning happening in Queensland as well, but that's had to be postponed for now. One of the other areas was that they wanted to make sure that you are valued, listened and respected, being respectful and empowering. They were wanting to make sure that you have access if you make an access request to help you navigate the NDIS system, participate in the planning process and use your plan supports. So they wanted to enhance the planning for people with psychosocial needs and improve staff training to increase capability. And then finally, the connected is that they wanted to try and break down barriers. So for example, in remote areas, remote communities, they're trying to put a program together to connect people, but that's also had to be put on hold for the time being, unfortunately. But another area is just with the removal of gap between plans, which was a problem. So they've got a plan extension approach, and if you have any unclaimed funds between the plan and the service bookings, that you've got 90 days now after your new plan's approved to continue to use those funds. So hopefully that's been a little bit informative for what's happening on the systemic front. And Karen, I'll take it over to you to keep talking about the advocacy component.
Okay, so I'm just going to move now on to some of the current changes. Now, there's been quite a lot of changes, and there constantly will be with the scheme, but obviously there's been a peak at the moment with the changes around COVID-19. So I'm just going to touch on what I think are the most relevant. I'm not trying to say that this is an exhaustive list by any means. So just to kick off, the one that's hit a lot of people hard and been a real concern for everyone is the personal protective equipment and the PPE, and particularly we've been following the people that are self-managing being able to access that, not just providers. So I'm just going to let you, the current health guidelines have not changed in that the recommended use of the PPE is only when someone is actually displaying COVID symptoms. Otherwise, the health advice is considered that it's not necessary. Now, that might not be your opinions, but that is still the health guideline. So that's what's going to be, directing response by NDIA for people that are requesting the PPE equipment. So if you're self-managing and you're requiring this equipment for workers in your home, you can contact the National Medical Stockpile, of which the email's above on the slide for you. But keep in mind that this stockpile is for use by the worker, not by the participant. Okay, so that's the way the stockpile and the health using this and sending this equipment out to you. So also just, you may not be aware that the Department of Health actually have some COVID training, which you could have workers attend, online training, and we will send the link to that training in the follow-up email as well. You just sign in and start to have a look at that. So that might be useful as well for people that are working around someone in your family. Leanne mentioned the school system. So the school system are separate from this national stockpile. They actually have sent, certainly Department of Education schools have sent an amount of PPE equipment to all schools. And then there is a supply centre. So we're not suggesting that amount of PPE is potentially enough. So if you've got any concerns with your school and with the health for your child, that might be in the school system, you can certainly, there's a email that we will send that can go directly to the disability strategy team to forward on the issue. But at the first step is talk to your school and just get them to get some PPE equipment from that supply centre. Any issues with that, then do come back to us. Okay, on the online shopping, and there's been a lot of media on this, and you probably are aware, so I'll just touch on it very quickly. NDIS participants do have a priority access to receiving groceries through participating supermarkets, which is pretty extensive with Woolies, Coles, IGA, Foodworks and Harris Farm. So you register, you get a unique code, and then you use that code at the checkout. So, so that's, you may already be utilising that. That's been around and had quite a bit of media attention. The light touch reviews, we've been hearing about light touch reviews for years, but it's never been very clear, and people will get very different responses when they ring the 1-800 number or talk to their LAC, etc. But the NDIA can make small administrative changes to a plan without it becoming a full-blown internal review. So changes such as you want to change the plan management system to self-managing in a certain area or over the plan should not be creating a full-blown internal review. It should be what they call a light touch review or an administrative change to the plan. So, you know, really you do want to avoid doing an internal review if possible. Some of you may have been down that pathway, and it's a very lengthy, time-consuming process. So changing those sorts of smaller things that you notice might be incorrect, you should be just talking to your partner organisation if relevant, or straight to the NDIA. If the 1-800 responder or the NDIA are just saying they're unaware, then do that #5, get forward, move forward on that, and just continue to discuss it. Because certainly at the NDIA as a body, this is something that is absolutely still valid, not just in the COVID time, to do these administrative changes much faster and simpler. Any issues, again, talk to us and we can be going through that escalation team, and I have had success doing that for families, to go through that advocacy escalation team and get things moving forward. Okay, with the low cost assistive technology, so this is really a very short-term measure to support participants to continue accessing supports when we're doing such a lot of online work. That's extending the flexibility of the existing funds in your plan, mainly in the consumables budget, but if you don't have consumables funding, it's also through the capacity building funding lines. So a family we know certainly has succeeded very recently in getting an iPad at the cost of $1,500 for her son, and it was needed to meet his needs and to reach his goals within his plan. The NDIA do say that you need a service provider to confirm in writing that the device is necessary. However, this parent was self-managing. They were able just to show it by drawing the link between, you know, the goals and the plan and the need for that piece of equipment. They didn't need any service provider letter. So, you know, don't let that be a barrier to you. This family was self-managing, so they didn't have a provider to show that letter necessarily, but that's not, it went through okay, so don't, as I say, let that be a barrier. Now, there are a couple of stipulations on it, that the item is to be of a lowest spec. They're not going to be providing, you know, the highest end items in this for this low cost assistive tech. It does need to show that it's relevant to the goals and the plan. So the participant shouldn't already have that. They shouldn't be able to access it through education or health or any other system that might be relevant. It is up to only $1,500, and it's not about smartphones, watches or tablets that are connected to a mobile. And it's not about replacement, or it's not about accessories to add on, that sort of thing. So it doesn't include obviously your internet and utility costs, that sort of stuff. It actually can include fitness equipment. So that might be something that you weren't potentially aware of. So there's that's kind of in a nutshell about that low cost assistive tech. It really is there it's only here till September 2020, and they are reviewing the use of this about, you know, a lot of these things are getting reviewed around June, July, but it is there till September. So I would encourage you, if it's needed, to get onto that. Okay, the increased flexibility. So if core funds are low, you can actually move funds from capacity building to core. So again, ringing the 1-800 and getting it organised. In the future, there will actually be even more increasing flexibility. It's not just about the timings now, but they move forward quickly to make this flexibility be available in this current period. But it is something that was planned and will, I think, be continuing on. Plan and agency managed actually had this flexibility already, and now self-managing people plans are now having it available from June now. So that's just started as of today, clearly. So that flexibility between all your core supports plus flexibility between capacity and core is now at its heightened. So take use of that. There is extension of plans where there's an automatic now 12-month extension. Will occur in plans that don't, so that they don't expire. Okay, so there's also an option of 24 months available, and existing core and capacity building funds will be applied to the new plan. So we'll just continue on with those current funding amounts that you have in your core and capacity at the moment. It's not increased due to the 10% of service providers had an increase of costs for their workers. That's not going to be added to your plan, but they just, the NDIA's word is just keep using the plan. Obviously, you can do internal reviews if necessary, but it does mean that there's no longer a gap in the plans, which has caused a lot of issues in the past, where you were trying to make payments on something that had finished, etc. So, and there's 90 days to complete and use unspent funds from one plan to the next. So that's some increased flexibility there in your plan. Finding support workers was the last point here that I wanted to say today. So there's now fairly new, I'm not sure how long it's been around, not only a number of days, if not a week. Finding support workers, there's a new dedicated page which we'll again put in our follow-up, where it's easier to locate workers through 12 different job platform sites. You may know Higher Up and Mabel, and there's another 10 sites that they've put onto this page just to make it a bit easier. And there's also been some changes to visa requirements for workers that are on visas to keep these workers in the workforce as well. Okay, so that's the snapshot of the current changes. I was going to now just have a look at some tips around the reasonable and necessary test that Leanne mentioned with the current court case, current rulings. So the reasonable and necessary criteria, we've got a flow chart actually, so I don't know, Clara, if you wanted to put that up now, that we've had on the Family Advocacy website. We put this together some time ago, because the reasonable and necessary test continues to be the yardstick by which decisions are being made, regardless of the COVID time. So using this flow chart to determine if the support that you are requesting actually aligns with the NDIA rules, and using the increased flexibility on offer to make the plan work really hard to reach your participant goals. So you can see just what we've tried to do here is on the top line are the main criteria that the NDIA, so if you're asking for a particular support, the plan is going to look at those and go, right, first, is it effective, beneficial and good practice? So was it recommended by an allied health professional, for instance? Is there evidence to suggest it's a type of support is considered current good practice? If it is current support and you've got some you can show beneficial outcomes from the support in the past as well, then yes, reasonable and necessary. And again, going through the others as well. So it's about the support being effective, about achieving the goals in the plan, about being able to help someone participate socially and economically, representing value for money. And I know some people feel that that becomes the highest priority in this criteria, but it does need to represent value for money, but these other ones are equally high criteria, so don't just focus on that one. Is it reasonable for families to provide it? And also, is the NDIS the most appropriate funding body? So this is just a good little checklist to go through when you are looking for adding support, and remains the criteria for plans moving forward, regardless of the COVID time or not. So you can take that, yeah. So looking at that, I think the point that's always been the case for the NDIA is really keeping a strong thread alive between the vision you have and the person has around their life, with the goals that they want to achieve and the plan that's put in place, and just keeping that as a very clear cause and effect, if you like, that this support is helping them to achieve this, which is these outcomes and helps with these goals, remains the most important test, if you like, on the use of support. Check the flexibility that we've outlined for opportunities as you're going through this, and the extra flexibility, and get ready to request away and push for the things that you want to achieve a good plan and a good life for your person. I kind of see it as the window's cracked open a little bit as more for opportunities at the moment. So it's not the time to sort of rest on it. It's the time to re-look at that plan and make sure that it's doing what you need for your person. I think there was a question in the chat about this as well. So the 10% service provider increase is the last point I'm just raising here. There's been a temporary provider increase of 10% to maintain a workforce of support for people with disability. So that's something that the NDIA did quite early on in this COVID time. It is only for a short period of time.
I've just answered that, Karen, if that helps. It's it ends on the 30th of September, not the 20th. I've written 20, but it's the 30th of
It was
September.
2020, it meant.
With the
2020,
review
not
before
20th.
the end of June. So yeah, it's only for
so that's what I was about to say. That's fine. So you answered that. So just reiterating. So it's a temporary one. A change of circumstances is also still a valid option to use if you need to. This increase is until September 30, but as Leanne said, the review is now due for them to have a look at how that's working. The rise applied to the assistance with daily living, but not the SIL. It applied to assistance with social and community participation and improved health and wellbeing and improved daily skills. So there was a 10% increase for providers could have put onto their workforce. And a lot of people have been, how is that impacting my plan? Now, the point there is that your planning will automatically roll over anyway, as I've said. So, and if you are getting to sort of 80% of your plan running out of funds, then you absolutely can contact the NDIA and get things moving to change the plan, but they will not increase the dollars of your plan based on this 10%. But what the NDIA do say, and I have looked at their stats actually, is that most plans don't actually reach 100% of take up of funds. So they are really of the opinion that this won't actually impact the actual person themselves. But let's keep check on that. If you have issues with your plan extension or running out, get straight onto it, and you can certainly contact us as well. Okay, so we've just got some helpful links and then we can open up to some questions. So these will be part of the slides that you receive back. Obviously keeping socially connected, we've got a dedicated web page and you'll find that reasonable and necessary flowchart on that. And there's a few dedicated pages you may have already seen yourself. One that is particularly useful for self-managers is that fourth one. There's information pack and there's one specifically for self-managed participants. And I recommend you having a look at that. And then that final one is the support workers matching website platforms that I mentioned in the presentation. So thank you for your time and input into the chat. I think there's been a bit in my section to chat. We have got a few, we can certainly start and have some conversations or discussions. If you need to go, obviously, please feel free to go. Don't be worried about that. You can, don't forget, our office is open. Please just do call us up for individual conversations. Or to maybe provide some intelligence and information to us around what's going on for you.